Crohn's disease, sometimes referred to as irritable bowel syndrome or IBS. I'll be telling you a little bit more about this gastrointestinal disease, what are some common symptoms, and how it's affected my life personally. In Laurent Biaggieri's scholarly journal called Predictors of Crohn's Disease, published December 13th, 2005 in the Gastro Journal, states, Crohn's disease is an inflammatory condition of the gastrointestinal tract that is often disabling through chronic symptomatic inflammation and or frequent clinical relapses and or clinical consequences of intestinal irreversible lesions, otherwise known as tears, or intestinal resections, which would be having to go to the hospital and having a portion of your intestines removed and the rest reattached. Some common symptoms stated by Professor Daniel C. Baumgart and Professor William J. Sandberg in their article Crohn's Disease, published August 12, 2012 in the Lancet Core Clinical Collection, states that the start of these symptoms can be blood or mucus or both in your stool, cramps, inconsistent nocturnal diarrhea, recent intestinal infections, active or passive smoking, family history of Crohn's disease or other inflammatory bowel diseases. If you have any sort of symptoms like this, you would definitely want to go to a doctor and get a screening. Oftentimes, you'll get a stool sample to where they will send your stools, your feces, off to a lab to get it tested and see if the inflammation levels of your intestines are high. They can also do blood work as well. Now, my personal fight against Crohn's disease started when I was age 13. I was a freshman in high school. I had recently been diagnosed with Crohn's disease. No one in my family other than me has this disease, and it's not in my history. So that was kind of a shock to us. I noticed abdominal cramping and blood in my stools along with mucus. That's what kind of freaked me out at first, and so we got the blood work done and it came back positive. I had high white blood cell count, which usually means for some sort of immune deficiency. Basically, your immune system, when you have high white blood cell, means that it's trying to fight off something. And also the inflammation levels of my intestines were skyrocketing as well. My approach, fortunately, was a non-invasive, not many medications I had to take, most of which was just supplements, so vitamins. I had a doctor that had a more holistic approach, a lot of which revolved around my diet. I didn't eat wheat, dairy, or sugar, and to this day I try to avoid it as well, just because my body doesn't digest it as well. I definitely recommend, if you're having any sort of symptoms like this, just first do some blood work, go to your doctor and see kind of what's going on, get a better idea. But overall, if you're having any abdominal pain or irregular bowel movements, health is a big thing, and a lot of that's contributed to your diet, so I would definitely recommend doing that. Anyways, thank you, and I hope you're educated on this topic.